So I think I'll just start by telling you the history of the Sisters of Charity of St. Augustine, which is pretty remarkable. I will underscore that I actually had the sisters in grade school. They had a great influence on my life. But again, their history in Cleveland is really pretty remarkable. They arrived 171 years ago, and they were the Cleveland's first public health nurses. They were invited to Cleveland by Bishop Rapp. At that time, there was tremendous need for care of the sick, and Bishop Rapp had been in France, and so he really knew of the sisters' capability both in healthcare and education. So they actually opened St. Vincent Charity Medical Center in 1865 and have actually been in the central neighborhood ever since. And I like to remind people that the sisters were here. This is their second pandemic. They were here in 1918 in Cleveland during the Spanish-American flu, and now here during COVID. So they certainly have made inordinate sacrifices, again, to take care of Cleveland's poorest. They have several ministries in Cleveland, including Joseph's and Mary's Home. You may know of the work for the homeless that the sisters have really been embedded in. Joseph's Home and Mary's Home, actually Joseph's Home was founded 20 years ago to really take care of patients that actually came into the hospital and were treated, but then were discharged back into the street. If you can imagine, if you had a diagnosis of diabetes or cancer or another major illness, and now we've taken care of the acute care, but you're going to get discharged back to the street. It was a prescription for disaster. The sisters saw that need and they created Joseph's Home, and now we have Mary's Home for women, so we're very proud of that work. We have the Sisters of Charity Foundation in Cleveland, which is a grant-making foundation that really does provide tremendous support to all of our nonprofit and looks really at poverty and homelessness. Building healthy communities, looking at community health needs assessments and where we can be of service. And then of course we have the Sisters of Charity Health System headquarters, and that's where I'm at right now. So, really very broad and deep roots into the central neighborhood. The sisters' constant mission has been to meet the unmet needs of the people we serve, not only their health needs, but emotional, social, economic, and spiritual needs. This is our constant mission, and despite all the changes we've seen in healthcare, and these changes have never really interfered with our model and sustainable mission to the poor. Judy, the next slide. So on September 14th, we shared with the community that we really recognized it was necessary for us to change as a result of the significant shifts in healthcare, and that really was the result of COVID. We were seeing an increased demand for outpatient services rather than patients being admitted into a bed and staying days or weeks for their care, but really a big transfer or demand for outpatient services. During COVID, we saw a rise in telehealth. Even in behavioral health, we were seeing where patients really could not come into hospitals or into offices, but we could meet their needs with the vehicle of telehealth. And then fewer patients really needing or wanting hospital stays. Again, if that was one thing that COVID taught us, that the hospital industry would change forever. So again, these were system-wide, industry-wide changes. We're seeing it all across the country, and especially I would underscore for hospitals, standalone hospitals in largely poor areas in the country, they are struggling the most. So COVID-19 made it even more difficult for us financially, and it magnified the challenges that the sisters were facing as it related to St. Vincent's. Next slide, Judy. So I was actually the president and CEO of St. Vincent's during COVID-19. It really had a profound impact on our ability to provide inpatient care. And you, depending on how close you were to healthcare, the very first thing that happened, and you may not even remember this, but on March 17th, Governor DeWine mandated that all hospitals, all health systems, stop doing non-urgent, non-emergent surgical care. And that really did have a profound impact on St. Vincent's. So I can remember on March 17th, going up to the ORs, and all our ORs were set up. We had about 100 caregivers ready to start surgical cases, and we really had to stop. The concern at that time was that there would not be enough personal protective equipment across the country because of the surge, that if we didn't stop mitigating some of the surgical cases that use a lot of PPE, we would really have a tragic problem when the surge came. So the number of patients decreased dramatically for us. And in that first month alone, St. Vincent's, because of the loss of that surgical volume, lost $3 million. So again, the pandemic definitely compounded our financial challenges. So, and in fact, I just want to call out that over the last, for decades, the sisters have subsidized the operations at St. Vincent's at tremendous losses. And again, in these last 5 years, it really was becoming more and more difficult to cover those losses. Next slide, Jude. So we reached a point that the health system could no longer continue to subsidize those losses, and that we really were putting the sisters and all their other ministries at risk. And just to let you know, they have ministries in South Carolina, in Canton, and in Cleveland. So for this reason, we made the difficult decision to transition St. Vincent's from a traditional acute care hospital to an ambulatory care provider. And that actually happened on Friday the 11th, when we stopped and seeing inpatients, and our ED closed at 3 o'clock in the afternoon. Next slide, Jude. So these necessary changes were difficult for all of us, and including for our caregivers, whom I really have to express my deepest gratitude for all that they've done. Consistent with our Catholic social teaching, we've been doing our best to support our employees, and that was really important to us, and certainly to the congregation of the Sisters of Charity. We have actually a little over 100 positions that will remain at St. Vincent's to provide ambulatory care, and we will continue to see patients both with behavioral health issues. Rosary Hall is a mission and ministry of the sisters founded by Sister Ignatia Gavin. First, it was founded at St. Thomas in Akron, which the sisters owned and operated. And then they brought that program in the 1950s to St. Vincent's, again, to take care of those that suffer with alcohol or drug addiction. For the other approximately 600 positions, we partnered with more than 30 Cleveland area institutions, including several employers with union workforces, and hosted a number of career events. One of the special gifts of St. Vincent's is its caregivers, and the caregivers here, most of them have spent their entire career at St. Vincent's. They have never worked in any other system. That is because of the mission that draws the staff here. So we did achieve our goal to help a vast majority of our caregivers find new employment and as seamlessly as possible, and we're grateful for that because we know it was really a big change for them. Next slide, Jude. So this will just show you this. This is the reconfigured ambulatory services that we'll be providing. So we will have primary care on the healthcare campus, the main campus here. And also we see patients in the Sisters of Charity Health System building that I'm in right now. We will have same-day walk-in visits for adults, both in the health system building and across the street in the healthcare center. That will happen December 2nd. The Sisters of Charity St. Vincent Medical Center actually had an internal medicine residency program that actually has transitioned to university hospitals. And so the residents will be in orientation until December 2nd. But when they complete their orientation, they'll come back to our health campus and be seeing patients in the HCC. We also have occupational health in the Sisters of Charity Health System building. Also, we have a pharmacy that will be operational Monday through Friday, 9 to 5 for patients being seen on the campus. We have outpatient behavioral health services in the St. Vincent Medical Office building, Rosary Hall, again, for outpatient addiction treatment. And then the psychiatric emergency services is on the main campus. As you know, there are only 7 psychiatric emergency departments and services that are offered in the country, and actually 2 of them are in Ohio, and St. Vincent's has really been the sole source of the emergency department for decades. And then we have a Solon campus that also provides occupational health and urgent care. Next slide, Jude. So as we move forward with this transition, we want to be clear that, and this is a rendering of work that we are working through right now as we look at how do we continue the healing ministry within the central neighborhood. And we've, in the last 2 years, done tremendous amount of work with our team here at the health system under the leadership of Sue Cray and others, and working with Mass Design out of Boston to really take a look at, as we transform our healing ministry, we really want to really look at the social determinants of health, and that is in particular food insecurity, housing, transportation, the need for education in an area that is the median income is about $10,500. It's one of the poorest areas in the country. And that literally is work that we really want to, work on to help this community. So as we looked, especially what we experienced during COVID, I just call out is that when the hospital had to close down during COVID, we couldn't let anyone in. It really impacted our community and our neighbors because our neighbors have nowhere to get food. They would actually eat at St. Vincent's and even purchase food there to take home because there is not really adequate food opportunities where we don't even have a grocery store here. So we actually developed during COVID what is called the Mission Kitchen with the help of Sister Miriam Urban, the staff over at St. Vincent's, and worked with CMHA to cook and make hot meals and get them to the poorest of the poor during COVID. And we're continuing that work today. But again, that focus on the social determinants of health, we really do believe is our future. Next slide, Jude. So we are really looking at, and I want to just say that as hard as the decision was to change St. Vincent's from an acute inpatient care hospital, we do recognize that we are really working to purposely engage a diverse community partners in complementing the traditional healthcare services that we have provided, but again, to come together collectively to improve health outcomes for the people that we serve. We want to address health disparities and improve health outcomes by really including additional services beyond acute healthcare. And you see this diagram that really looks at the need for safety, racial equity, community leadership, our commitment to spirituality through the sisters, our culture of wanting to care for the poor and those that really have so many unmet needs, the need for beauty in our community. And we know that it's going to take, all of us coming together in new ways to provide care to our community. We're going to build out the changing footprint of what was once exclusively an acute care hospital into a campus promoting holistic wellness. And we really believe that prism of wellness is really important. There's so much trauma that, our neighbors and those that live in the central neighborhood have experienced over decades. And we really feel this is a perfect time for us to really look through the lens of holistic wellness. It enhances, too, our opportunities for economic development and revitalization of the central neighborhood. So, Judy, I think that's the last slide for now. And with that, I will stop and answer any questions that you have. You don't realize how fast 10 minutes is, but that is the story, the Cliff Note version of St. Vincent's, and the definite dedication of the Sisters of Charity to the work in this neighborhood. So I'm going to stop there, and I'm certainly happy to entertain any questions.
Thank you so much, Jan. We have had a couple questions come in. So just to start us off, what has been your biggest challenge in this work and in this decision, and how did you work to overcome it?
Yep. So, I think that what was so difficult was that the longevity of the sisters being here since 1865. And when you have that kind of longevity, the thought of abandoning actual acute care the way we once knew it was really very difficult. And yet we totally understood, and it took a lot of, we looked at every possible model to keep St. Vincent's here as an acute care hospital. And we had done that work prior to COVID. We had a strategic plan that really looked at St. Vincent's as being a specialty hospital with a surgical portfolio of, we did bariatric surgery and also high-end spine and orthopedic surgery. Some of the probably most complicated surgery in the United States was being done at St. Vincent's. And then on the behavioral health side, a deep commitment for caring for those with behavioral health issues, and in a very special way, Rosary Hall. But unfortunately, when COVID hit, we really recognized that the volumes that we would need to be able to sustain St. Vincent's as an acute care hospital were not coming back. And so I think facing that reality was really the hardest. And, when you're in the middle of it, you just think there's no other way out. And yet we really, with our faith and with, guidance from the sisters, really realized that it was time for us to make this bold move. And again, focus on our future with the social determinants of health, because there's such need in this community.
Yes, keeping with that community thought for a minute, I understand you tried to listen to the community as you made this decision. Yes. What were their concerns and how did you respond?
Well, it's interesting that, again, the work was really very centered around the community and listening. And there were countless meetings and group gatherings and convenings to talk with, our neighbors about what their concerns are. And I think that having lived through COVID and just seeing how they were impacted, so you don't really realize. So the connectivity to the internet, a lot of information was coming that our neighbors can't get because we are the internet connectivity is woefully inadequate. So there's work being done on that. I think that, no doubt our neighbors, as we talked about, re-envisioning our campus, safety, the safety of the neighborhood, the safety for their children, the safety for their families, being safe to walk out at night. And we know that those are issues that, our whole community is grappling with. And we want to make sure that we're a part of that and actually hear that. We want it to be safe where they feel welcome and, it can heal. We're trying to create a healing environment and not one where people continuously live in fear and quite honestly, danger.
Obviously, the scope of work here is vast. So how did collaboration with other community partners help you, and how will you continue to lean on that moving forward?
Yeah. So one of the sisters' strong tenets of their, mission work is that they've never done it alone. And we really recognize that. And we do have, great partners. Certainly during COVID, I can honestly say that the other health systems, Cleveland Clinic, UH, and Metro, myself, we really did come together because we had to. There were needs that we had, and I can honestly say probably the first time in my career where I saw all of us coming together, again, to make sure that everyone was being cared for. And so an example was Cleveland Clinic helping St. Vincent's with our COVID testing. And we really, really did need their help, and they stepped right up to the plate. So I do think that as we move forward, our success is going to be how can we build partnerships and bridges. We don't believe we have to do it alone, and we know that we can't. We don't want to, but we definitely want partners that have the same passion around creating a healthy environment and a place where our neighbors can actually not just survive, but they can thrive. And that is our goal, and we're not going to stop. So, but we have great partners, and we will continue to work with them.
And I'm sure this decision was not easy to come to. So how would you advise other leaders facing difficult decisions in their roles?
Mm-hmm. So when you're facing something like this, and I was thinking through my whole career in preparation for this, as leaders, you are going to have to make some very, very hard decisions, and they won't be popular, and there may be different views. But I would tell you the secret is always having a vision for what you think the future will be and being able to articulate that. There has to be a vision that provides people hope and the fact that we have a future ahead of us, and being able to articulate that. And you know what? Give people time and space to let that, change. That they can accept it. It was very hard on our staff. As I said, one of the best blessings of St. Vincent's is many of our staff have worked here 30, 40, and 50 years. They never worked anywhere else. And so, the magnitude of the change for them was huge. And so we really needed to allow them to go through those emotions of, some sad, some angry, some, not sure what the future would be. But again, continue to create a healing environment for them and help them move on to the next step for them in their career. So again, I think having a hopeful vision and being compassionate, you have to understand that, as leaders, we do have to make the tough decision, but we have to create an environment where there's empathy and compassion and understanding. And I feel that because of the influence of the sisters, we were able to do that.
And how do you, there was a good bit of criticism in the media related to the decision too. So how do you keep positive when it feels like all you're hearing is negative around you?
Yep. I think that unfortunately in my career, I've been through other hospital closings. So I was at the Cleveland Clinic during the closing of, Huron Road. I was also at Lakewood. I was the president of Lakewood when Lakewood, had to transition to a family health center. And these are difficult changes. And there will be criticism. And as leaders, we have to understand that. I think, though, we always have to tell the truth. And the fact is that a standalone Catholic hospital without a partner and with decreased volumes that were really substantial, we couldn't go on, and we were never going to risk all our other ministries, because we know there are people that need food, that need education, that they need opportunities, and we can meet those needs. But yes, there was certainly strong criticism. There were factions out of St. Vincent that were really pretty aggressive. And, again, we refuted, when there were issues out there that weren't the truth, we corrected them, but we moved on and continued with our vision for the future.
Thank you so much. And our last question is, how do we meet the critical needs of the ever-growing population in need of inpatient and psychiatric services that were previously provided?
Yes, I would tell you that I think our entire country is struggling with behavioral health. I think that it's something that we all have to come together. I think everyone has pieces and parts of trying to help individuals, but it is way bigger. And I don't think, candidly, that it has the right resources. I think that we're blessed. We are really provided support from the Adams Board to run the psychiatric ED here at St. Vincent's. And that's really important, but we need more. And I will tell you where we really, and this is my estimation, that I really worry about is for children and adolescents. There is not enough help for families that have children and adolescents with needs. And we know that that is actually, creating problems, that actually are very detrimental to our children and adolescents. So our commitment is, and again, we have Dr. Biscaro, Dr. Garvin, working with other partners in the community to say we must come together and work on this together so that we can create a continuum and where people can get the care they need before they need to be hospitalized, because that's not really the best care for them.
Well, Jan, thank you so much. We really appreciate your time today.
Oh, thank you.